Paying more for health insurance in Massachusetts because of the Affordable Care Act. It is a story the 22 News I-Team has been following, and I-Team reporter Ryan Walsh had an exclusive interview with the man in charge of the state's health connector.
Smaller insurance companies like Health New England say they may have to raise insurance premiums drastically if the state doesn't do something about the risk adjustment provisions of the Affordable Care Act. Risk adjustment provision fair to what we already have in place in Massachusetts?
Well, I won't be one to comment too deeply on fair or not fair. It is the law.
Risk adjustment figures out which health insurance companies have sicker patients and then pays them for it. Those companies, at this point it's Blue Cross Blue Shield, would be paid millions of dollars directly from other insurance companies like Health New England. Massachusetts is the only state that have its own risk adjustment methodology.
It was communicated to us that our federally approved methodology was one we had to live by.
We're waiting to hear if the federal government will grant Governor Baker 2 waivers to the Affordable Care Act, but risk adjustment, which is where money transfers from insurance company to insurance company, won't be one of them.
We don't see a waiver as being in the cards right now. Very fortunately, we're at a very different place in terms of the perceived need for that waiver.
Gutierrez told the I-Team that the initial numbers of potential $50 million payouts have gone down as they continue to go through health care claims from 2014. At this point, their estimates are only 75% accurate.
Many of our fears that were initiated by the earlier numbers are greatly reducing.
The final bills will be sent out at the end of June. Health New England wouldn't release the latest numbers, but did say in part, our financial exposure does not appear to be as drastic as we initially expected. We are concerned that Western Massachusetts will end up subsidizing insurance premiums elsewhere in the state, and Massachusetts should not be punished for implementing universal coverage nearly a decade ago. I'm Ryan Walsh, working for you with the 22 News I-Team.